So my name is Sandile Masugu, and I'm a Strategic Information Officer, and I'm with UNAIDS Regional Support Team, Eastern and Southern Africa, based in Johannesburg. And I would just like to welcome everyone to the session of our Fresh Insights. And the focus today will be just unpacking HIV data, looking at the evidence and the trends that are shaping the Eastern and Southern Africa region. So basically, Fresh Insights, it's basically coming from a new platform that we are trying to establish as the regional support team in Eastern and Southern Africa, just to share new knowledge and also new information, data, and ideas in order to shape our HIV response in the region. So normally we take around 30 minutes time maximum for the session, and just looking into the methodology of that new information or any findings that we want to share, and also just to highlight recommendations that is coming in with the new information that we are sharing. So before we start, we would like just to go over just a few housekeeping rules just to guide us as we are going through the session. And just to highlight the first one, we will be recording the session, and I think you've already received notifications from your end that we are recording this session, and we will conduct the session in English, and unfortunately we do not have any interpretation that is available today. And as part of this, we will also just share the recording of this session, and as well as the presentation that we are going to do at a later stage today on the UNAIDS East and Southern Africa YouTube channel. And please do subscribe and like that YouTube channel so that you can get notified when new information is being shared. And just one last on the, we'll try and answer any questions that you might have, but we would just request you to put any questions that you have on the chat, and towards the end of the session, we'll try and respond to all of those questions. And just one last one, please make sure that we are muted throughout the session, and allow the speaker that is currently speaking to be able to communicate effectively with all of us on the platform. And with that being said, I would like to introduce briefly Ali Fezada, who is our Strategic Information Advisor. And Ali, please do introduce yourself and take it away after that. Thank you. I'll come back later when we are doing the Q&A, but definitely please remember to put all your questions in the chat box, and then we'll try and address them towards the end of the session. Over to you, Ali.
Thanks a lot, Sanele. Can you confirm if you can hear me? Thank you.
Clearly, yes.
Good afternoon, everyone. I'm joining from Nairobi. My name is Ali Fezadeh. I'm the team lead for strengthening national capacities and dissemination from the Data for Impact practice of UNAIDS. It's a pleasure to be with you today, and I will go through some key highlights from our recent data that was collected through the Global AIDS Monitoring, or GAM, and the HIV estimation exercise that was started from late last year, from December, and continued till May, that data collection. I will walk you through that data. Please let me know of questions through chat, as Sanela mentioned. All right. Let's start with the number of people living with HIV in the region. As you can see, the number has constantly increased at different rates over the years from 1990 till now. And it was estimated that by December of last year, 21 million people, adults and children, were living with HIV in the region, in the Eastern and Southern Africa region. Please have in mind that whenever we are talking about an estimated number, it always comes with an uncertainty. As an example, you see here the shaded area, which shows the uncertainty interval for our estimates, and To be exact, the 21 million estimate was could have been between 19.5 million to 23.4. I will try to share that uncertainty whenever it is possible or whenever it is advisable. What some important thing to consider is that while we talk about that total number of 21 million, the distribution across different sexes and age groups are different. Just to give you an overall picture of these people, 13.2 million were adult women, and 0.1 million were adult men, and 810,000 were children. Again, these numbers have uncertainties around them. But when it comes to the countries that the people with HIV live, we see that the largest group are living in South Africa. South Africa has 7.8 million of the people living with HIV in the region, which is the largest number, as you can see, and then it is followed by Mozambique, United Republic of Tanzania, Uganda, Zambia, Kenya, and it continues. Something that I want to bring to your attention. Here we see the number of people living with HIV at different age and sex categories. The inner ring is the estimations for 2010, and the outer ring is the estimation for 2024. We know that the total numbers, as you saw on the earlier slide, has increased between those 2 years. Something that is of very importance is that when you look into the changes in the demographic composition of the people living with HIV in the region, as an example, we saw that while 13% of people living with HIV used to be adolescent girls and young women, females 15 to 24 years old, it has reduced to 7%. And remember, we are talking about people living with HIV, not only new HIV infections. And we see the changes, you see those changes across the different age and sex groups. But something I want to bring to your attention is the last two segments of both rings. So in 2010, we had 5% women, 5% of all people living with HIV, adult people living with HIV were women 50 years and older, and 4% were men 50 years and older. But when we reach to 2024, in 14 years' time, those numbers increased to 15% and 9%. So in total, we have almost a quarter of all adults living with HIV to be 50 years and older in the region. When we talk about the new HIV infection, again, the important thing is that we see a decline from the peak of the epidemic in the mid-90s. We see that 94, 95, 96, where we had the highest number of new HIV infections in the region, and this has continued decrease to 2024. This decline has been 56% in total, but if we only look at the adults, it has been a 53% reduction. When we look at the number of new HIV infections, which in total were 490,000 new infections, of these 280,000 were among adult women, 150,000, of these new infections were among adult men, and 55,000 were due to vertical transmission. Again, if we look at the distribution across the countries, what we see is that, again, the highest number of new HIV infections were in South Africa, but that followed by Mozambique, United Republic of Tanzania, Uganda, Zambia, Kenya, Madagascar and Angola. It might come to you that while Madagascar has a much smaller portion of total people living with HIV, when it comes to the new HIV infections, it's higher on their ranking. Something that I would like to bring to your attention, we will not go into many details of it in this presentation, is the inequalities as well. As we saw, the number of people, new HIV infections, and number of people living with HIV was much higher among adult women to adult males, and we see that while both figures have declined over the years, they still remain higher among adult females than adult males. And specifically, if you look at the rate of decline between 2010 to 2024, we see a 59% reduction among adult men, but only a 49% reduction among adult women, a 10 percentage point difference in the reduction, which highlights one of the key inequalities in the region. When we look at the age and sex composition of the new HIV infections between 2010 and 2014, we see interesting changes. While on the previous similar slide, I put the 2024 estimates as the outer circle and the 2010 as the inner circle. In this one, as you see, it is the other way around because fortunately, the number of new HIV infections in 2024 is much lower than the number in 2010. So we see some of the percentages has remained more or less the same. As an example, we see that for adults and girls and young women, again, 15 to 24, the proportion has slightly increased from 31% to 32%, so almost still a third of all new HIV infections among adults is in that group. The share for adolescents, boys and young men, 15 to 24, has slightly decreased from 12% to 9%. And you see the other changes. What is important to see is that the changes, we see smaller and smaller shares for all groups of adult men compared to adult women. That's all age groups. We just compared the HIV, new HIV infections across the years. But we know that the new HIV infections is also related to the population. Maybe one standard statistics that we have is the HIV incidence per 1,000 population between 15 to 49. But again, we see it has declined. We see a 69% decline in incidence. You might ask yourself that if the incidence has declined by 69%, why new HIV infections has declined by a smaller number? It's because the population has grown over these years, over that 15 years. Using incidence allows us to better compare between the different countries. So we saw that the largest number of new infections were coming from South Africa. This is partly because of their population size there. If we look into the HIV incidence per 1,000 among adults, 15 plus, across the countries in the region, while we see the regional average as the line, we see the different columns there, and we see Eswatini, in fact, has the highest incidence, followed by Mozambique, and only then South Africa. And then you can see the other countries in that region, and we see the lowest incidence we have in the region is in Comoros, and unfortunately, we didn't have any estimates from Mauritius. Now let's have a look at some key elements of the response, which is the progress toward the 95, 95, 95 targets. Just for all of us to be on the same page, when we talk about the 95, 95, 95 targets, we mean that percentage of people living with HIV who know their status, percentage of people who know their status who are on ART, and percentage of people on ART who achieve viral suppression. If we look at those figures, then we see that on the first 95, we moved from 88 to 93% on knowledge of status. We moved from 82% to 91% on receiving ART for those who know their status, and we reached from 89% to 95%. 1 year ahead of time, we reached the target on the third 95 on the percent of people on ART who achieve viral suppression. Then this number translates into what we call as HIV testing and treatment cascade. When we talk about the cascade, the first one is the same percent of people living with HIV who know their status, but for the second and third indicators, the denominator remains all people living with HIV. So the second one in that cascade is the coverage of people living with HIV receiving ART, and the third one is percent of people living with HIV who have suppressed viral loads. So the target for the first one is the 95%. We saw that increase from 88 to 93%. The target for the second one is 90% of all people living with HIV, that we have reached to 84% from 72% in 2019. And the target for the third one, for the viral suppression among people living with HIV, is 86%, that we have reached 80% from 64% coverage. However, we see the constant increase in the coverage, but we see the inequalities here again. One key inequalities that we see is that while the ART coverage among adults have reached 85%, which we only see the coverage among children to reach 61%. And we see that this coverage has remained more or less stable over the past few years. And with the constant increase in coverage among adults, the gap between adult and children is only widening over the past few years. There is also another inequality in access to ART, that is between adult females and adult males, adult men and adult women. We see that adult women ART coverage has reached 86% over the years, and for adult men, it's only reaching 81%. It is of notice that you can see that in the earlier years, the gap was larger, and it has been closing, that gap is being closing over the past few years. So while the age gap has been widening, we see that the sex gap is closing, which is good news. Another source of inequality in this region is between countries. Unfortunately, we do not have time to go within countries because that one also exists. We see that we have countries who have not only reached the 90% target, but even past the 90% targets for coverage of ART. We have Botswana, we have Namibia, we have Rwanda, Zimbabwe, Eswatini, Lesotho, Zambia, that have passed the 90% target. But again, this is all level. We saw that there are the population inequalities, and even within countries, there are geographical inequalities. And at the same time, we have Madagascar, Angola, and South Sudan with very low coverage from 29% to 50%. So we see this big inequality within the region. The last estimate that I want to share with you is about the AIDS-related death. As we know, the AIDS-related death depends on 2 points. One is the mortality among people living with HIV, AIDS-related mortality here we're talking about, as well as the new HIV infections. And we see a decline, a 59% decline between 2010 and 2024 in the number of AIDS-related deaths across all ages. I will not go into the different subpopulations here. Just to have some key take-home messages from this presentation. One is that the HIV epidemic in the Eastern and Southern Africa region is the largest in the world. Almost 52% of all people living with HIV and almost 38% of all new HIV infections are from this region. So we cannot end AIDS globally until we end AIDS in the region. While we see the reduction in the number of new HIV infections and AIDS-related deaths, which is impressive, and it is the largest decline globally, it still falls short of the targets for ending AIDS. So we need to continue, but double down on our achievements. One important thing is that we see that the decline in the number of new HIV infections has not been equally achieved by all countries and all populations. We see unacceptable inequalities affecting women, in particular adolescent girls and young women, in members of key populations. Many countries have reached or are well in the path towards reaching the UNAIDS 95 targets at an aggregate level. Again, inequalities exist between adults and children, between adult women and men, and between and within countries, not even talking about the key populations. Another and last point to remember is that with a quarter of adults living with HIV older than 50 years, we see that there is going to be a growing need for services regarding non-communicable diseases, or NCDs, for these populations, which pushes us more to think about integration of services rather than the siloed responses. With that, I will finish the presentation. All the data that were used for this presentation and some of the graphs were directly from the AIDS Info website. You can reach AIDS Info website at aidsinfo.unaids.org, or you can easily scan this QR code that will take you there. It not only shows the data that's shared with you here, it has a wealth of data that includes data on key population, more on inequalities, on laws and policies, as well as the subnational estimations. With that, over to you, Sanele, and thanks a lot.
Thank you so much, Ali. Thank you for that clear presentation. And I think one of the things that really stood out for me is really on the gaps around the treatment coverage, especially around age, especially our children that are lagging behind in terms of treatment coverage. And I don't know how best we can work around as the region. But with that being said, I would just want to allow a few questions if you have any, but I've just checked the chat. We do not have any as yet, but I will just allow a few hands if there are any burning questions, and we'll unmute you and allow you to speak. If there are any hands, no, Ali, if you want to respond to the one question that we have from Eric on the treatment cascade slide. The question is around the 95% confidence intervals, and I think there was just a comment around that the confidence intervals are overlapping. So is it possible to state if there are any inequalities between the two groups? I don't know if you want to take that, Ali. Over to you.
Just to answer to Eric's question, yes, that's true. While we see the overlapping confidence intervals, but as we have seen this, this is not a one-time observation. This is the observation that we see on a continued basis. So I think with good confidence we can talk about these inequalities. But from a statistical point of view, I hear what you say. If it has been a one-time observation, that could have been one explanation, but we see the trends over times and it is highly likely that these inequalities do exist.
All right, thank you, Alu, for addressing that question. And with that, thank you, colleagues, and thank you for attending. We'll see you in the next Fresh Insights next month.